Right. So we're diving deep today into fetal well-being assessments.
Yeah.
I mean, you go to your first prenatal appointment.
Right.
And they start talking about all these tests that they do to monitor your baby's development. It's kind of mind-blowing.
It is.
It's like, whoa, we could see inside there and know all this stuff even before the baby's born.
Exactly.
So that's what we're going to be looking at today. We've got this chapter from a medical textbook that just lays it all out.
Great.
And I got to say, I'm already fascinated.
Yeah, it's really interesting stuff. I mean, being able to gather all that information about a developing fetus is pretty remarkable. And it all starts with like understanding the potential risks, right?
Okay.
So things like your age, pre-existing health conditions, even your blood type, all these things can actually play a role.
So it's almost like building this personalized picture of your pregnancy, figuring out what's normal for you and what might need more attention.
Exactly. So for example, like, let's say you have Rh negative blood.
Okay.
And your baby inherits Rh positive blood from the father. It can create what we call Rh incompatibility.
Okay.
Where basically your immune system might see the baby's blood as like a foreign invader.
Okay.
And start producing antibodies.
So that sounds a little concerning. I mean, is that something that they check routinely for?
Oh, absolutely. It's one of the many things we monitor during those prenatal visits.
Okay.
And the good news is, if it's identified, there are treatments available.
Okay.
Like a special injection called Rojam.
Gotcha.
And that can prevent complications.
So early detection is key there.
Absolutely.
Okay, so one of the tests that really stood out to me when I was reading this chapter was amniocentesis.
Yeah.
It seemed like it could tell us so much.
It can.
Not just about potential genetic conditions, but even about how developed the baby's lungs are.
Yeah, it's a really powerful tool. Basically, what we're doing is taking a small sample of amniotic fluid, which is that fluid that surrounds and protects the baby.
Okay.
And that fluid contains fetal cells, other substances that give us a wealth of information.
Wow.
We can look for chromosomal abnormalities, over 40 in fact.
Wow, okay.
Including things like Down syndrome, cystic fibrosis. And then later in pregnancy, it can tell us if the baby's lungs are mature enough for birth.
Oh, okay.
Which is critical information if there's a chance of, say, preterm delivery.
Right. So it's almost like getting a sneak peek, into the baby's genetic blueprint and their overall development.
Yeah.
But I'm assuming a procedure like that has to be carefully considered.
Yeah. Any invasive procedure comes with risks.
Of course.
And amniocentesis is no exception. The timing is super important. It's typically performed later in the pregnancy when those benefits outweigh the risks.
Right. Makes sense.
Yeah.
Now, the chapter also talks a lot about the nurse's role during amniocentesis.
Yeah.
And I was really struck by how much emphasis was put on the human side of it, not just the technical aspects.
Totally. Nurses play a huge role
Yeah.
in making sure the mother feels safe and comfortable during that procedure.
Okay.
They're providing emotional support, answering questions, guiding them through each step. They're also responsible for things like monitoring vital signs, making sure the positioning is correct, and even assisting the physician with ultrasound guidance.
So it's really a team effort with everyone,
absolutely
focused on the well-being
for sure
of both the mother and the baby.
That's right.
Okay, so shifting gears a little bit.
Okay.
Let's talk about the non-stress test.
Okay.
Or NST. This seems to be like a staple of prenatal care. It
is.
Checking the baby's heart rate in response to their movements.
Right.
So,
yeah, the NST is one of the most common tests we use. Yeah. It's quick, painless, and it gives us a lot of information about the baby's oxygenation and their central nervous system. The idea is that a healthy, well-oxygenated fetus is going to have a heart rate that speeds up when they move.
It makes sense, right? Like movement equals well-being, you know? And from what I've heard, it's pretty straightforward for the mom.
It is. You simply lie comfortably, usually slightly tilted to one side. And they place an electronic fetal monitor on your abdomen to track that heartbeat.
Gotcha.
Important to avoid lying flat on your back, especially later in pregnancy, because that can restrict blood flow to the uterus.
So that's all about finding a position that's comfy for you and the baby.
Exactly.
What kind of information does this test reveal about the baby's heart rate?
So we look for what we call accelerations, which are temporary increases in that heart rate. So a reactive NST, which is the ideal result, shows at least 2 accelerations of 15 beats per minute, lasting for at least 15 seconds within a 20-minute period.
So that 15 beats for 15 seconds, that's what you're looking for.
Exactly.
That's a sign that things are good.
Precisely. It suggests that the baby's central nervous system is responding appropriately to movement, and their oxygen levels are likely sufficient.
Okay, so before we took a little break there, we were talking about non-stress tests and how they help us evaluate the baby's heart rate patterns.
Exactly.
But the textbook also mentioned something called decelerations.
Oh.
What exactly are those?
So decelerations are temporary dips in the baby's heart rate. They can be totally normal part of labor. But in some cases, they can signal that there's a problem.
So not all decelerations are bad.
Right. Not all decelerations are created equal. It really depends on the type of deceleration and when it occurs in relation to the contractions.
So paint me a picture.
So let's say you're looking at a fetal heart rate tracing. You're going to see the baby's heartbeat, and you're also going to see the contractions.
So I'm picturing it. Like the baby's heartbeat's going along. And then suddenly there's a dip.
So if that dip happens at the same time as the contraction and it kind of mirrors the shape of that contraction, that's most likely what we call an early deceleration. These are usually caused by pressure on the baby's head during a contraction. And they're typically nothing to worry about.
So it's like a temporary response.
It's like the baby's head is getting a little squeeze. And that's what's temporarily slowing the heart rate.
That makes sense.
Now, if the deceleration starts after the contraction has already begun and recovers after the contraction is over, that's called a late deceleration. And this type of deceleration might indicate that the placenta isn't delivering enough oxygen to the baby during that contraction.
So that's where things might get a little more concerning.
Late decelerations warrant further investigation. Then we have variable decelerations, which are a little bit more unpredictable. They can happen at any time, regardless of contractions. And they often have kind of a sharp V-shaped appearance on that tracing. These are usually caused by compression of the umbilical cord. Which is temporarily restricting blood flow to the baby.
So like the baby's lifeline is getting pinched.
Yeah, that's a good way to think about it. Now, good news is most variable decelerations are brief and they resolve on their own. But if they're prolonged or happening frequently, that can be a sign of fetal distress.
So it's all about patterns and recognizing when something
might be off.
And skilled healthcare providers are trained to interpret these patterns and make those informed decisions about the best course of action.
This is so fascinating.
It's
incredible how much information
these
tracings can reveal.
It really is like a secret language, right? Revealing the baby's well-being.
Totally.
Speaking of secret languages, did you know that babies actually have distinct patterns of movement, sleep, even wakefulness while they're still in the womb?
I just thought it was all like random kicking and wiggling.
Not at all.
Fetal
behavior provides valuable clues about their health and development. For instance, healthy fetuses. They exhibit these predictable cycles of activity and rest.
Really?
They tend to be more active in the evening and less active in the early morning hours.
Interesting.
And as they get closer to full term, they spend more time in kind of a quiet,
sleep-like state, as if they're preparing for life outside the womb.
Makes sense, like they're getting ready.
Yeah,
that makes sense.
So how do we go about assessing this fetal behavior?
Right.
One of the simplest and most effective ways is through what we call kick counts.
So that's what all the moms are talking about when they're like, I'm doing my kick counts.
Exactly. It's a really powerful tool.
Okay.
You basically set aside a specific time each day, usually in the evening when the baby's most active.
Okay.
And you count how long it takes to feel 10 fetal movements.
Oh.
So if you notice like a significant decrease in those movements, or it takes a lot longer than usual to reach those 10 kicks.
Okay.
It could be a sign that something's not quite right.
So it's a way for moms to be actively involved in monitoring their baby's well-being.
Absolutely.
Which is empowering.
It is.
So are there other methods for assessing fetal behavior besides kick counts?
Absolutely. Ultrasound plays a key role.
Okay.
During an ultrasound, we can observe the baby's movements, breathing motions.
Oh, wow.
Muscle tone.
Okay.
Even things like yawning or sucking their thumb.
That's so cute.
It's pretty amazing.
Yeah.
Really reinforces that fact that babies are much more than just passive passengers during pregnancy.
Right. They're active little...
They're actively developing, learning, interacting with their environment.
That's so cool.
It is.
Okay, so you mentioned that ultrasound is used for more than just observing movements.
Yeah.
The textbook also talks about biophysical profiles, or BPPs.
Yeah.
What are those?
So a biophysical profile is a more comprehensive assessment of fetal well-being. It combines ultrasound observations with the non-stress test to create a more complete picture.
So it's a multi-pronged approach.
Precisely.
Gotcha.
The BPP typically includes 5 components. You've got fetal breathing movement, which are those rhythmic contractions of the diaphragm that simulate breathing practice.
Oh, wow.
Gross body movements like kicking, stretching, fetal tone, or that muscle tone and posture.
Okay.
Amniotic fluid volume, which is an indicator of placental function, and of course the non-stress test.
Wow, that's a lot of information to gather.
It is.
How is it all scored?
So each of those components is scored on a scale of 0 to 2, with a total score of 8 to 10 being considered reassuring.
Okay.
A score of 6 or lower might indicate that we need further evaluation or even delivery, depending on the situation.
So it's like a report card for the babies.
That's a great way to put it.
Yeah, yeah.
It helps us identify babies who might be at risk for complications and allows us to intervene early to improve outcomes.
It's incredible how much we can learn about a baby's health before they're even born.
It is amazing.
It really is. It really is.
Yeah.
So I'm curious, like, how do you, as an expert, weigh all this information, you know, the test results, the observations, and then decide what's the best course of action?
Well, it definitely requires careful consideration.
Right.
We're looking at the totality of the information, including the mother's medical history, her current symptoms, and of course, the results of all those assessments. But sometimes it's not just about the numbers. Sometimes it's about that gut feeling that you get as a healthcare provider.
So there's still a place for intuition.
Absolutely.
In this high-tech world of prenatal care.
I would even say that a mother's intuition is incredibly valuable as well. If something doesn't feel right, if you notice a change in your baby's movements, any concerns at all, don't hesitate to reach out to your healthcare provider.
That's such a good reminder. I feel like we've learned a whole new language.
We have.
When it comes to fetal well-being assessment.
I'm glad to hear that.
But before we wrap up, I'm curious, what's on the horizon for prenatal care?
That's a great question. And it actually leads us perfectly into the final part of our deep dive.
All right. So we're back for the final part of our deep dive into fetal well-being assessment. We've covered a lot of ground already, learned about all these amazing ways doctors and nurses can keep tabs on a baby's health even before they're born. But what's next? You know what's coming down the pipeline in prenatal care. Any new technologies or advancements you're excited about?
Oh, there's always something new popping up in prenatal care. One thing that's super promising is non-invasive prenatal testing. We call it NIPT for short.
NIPT. Okay. What's that all about?
Well, it involves analyzing little pieces of fetal DNA that are actually circulating in the mother's blood.
Wait, so you can get information about the baby's DNA just from a blood test?
Yep, pretty much. It's really changing how we screen for genetic conditions. Right now, we mainly use NIPT to look for common chromosomal problems, but there's a ton of research happening to see what else it can do.
Wow. Like what kind of stuff?
Well, in the future, we might be able to use NIPT to check for a whole bunch of different genetic conditions, maybe even predict things like birth defects or developmental delays.
That's incredible. It's like sci-fi becoming reality. But all this new tech, it seems like we're getting more and more information about babies before they're even born. Makes you wonder, where's the line?
That's a really important point. It definitely raises some ethical questions, you know? As technology keeps advancing, we have to be careful to balance the benefits of all these tests with the potential for anxiety and uncertainty, maybe even tough choices for parents.
Yeah, I can see that.
It's a big responsibility. That's why it's so important for expectant parents to really do their homework, ask questions, and have open conversations with their doctor or midwife.
Be your own advocate.
Exactly. Prenatal care is a team effort. It's you and your healthcare provider working together to make the best choices for you and your baby.
That's great advice.
Huh.
This has been such an eye-opening deep dive. I feel like I've learned a whole new language when it comes to fetal well-being.
Me too. It's been great chatting with you about it.
You too. And for all our listeners out there, remember, if you're curious about something, don't be afraid to ask. Do your research, talk to the experts, and most importantly, trust your gut. Enjoy this amazing journey. Thanks for joining us.